Hello, my name is Mary Rasica Raigo. I'd like to present you pedophilic disorder. Diagnostic criteria. Over a period of at least 6 months, recurrent intense sexual arousing fantasies, sexual urges, or behaviors involving sexual activity with a prepubescent child or children, generally aged 13 years old or younger. The individual has acted on these sexual urges or the sexual urges or fantasies cause marked distress or interpersonal difficulty. The individual is at least 16 years or at least 5 years older than the child or children in criteria A. Specifiers: exclusive type, attracted only to children, or non-exclusive type. Sexually attracted to males, sexually attracted to females, or sexually attracted to both. Another specifier is limited to incest. Diagnostic features. The diagnostic criteria are intended to apply both to individuals who disclose this paraphilia and to those who deny any sexual attraction to children. Examples of disclosing this paraphilia include acknowledging an intense sexual interest in children, indicating that sexual interest in children is greater than or equal to sexual interest in physically mature persons, complaining that their sexual attractions or preferences for children are causing marked distress or psychosocial difficulties. However, individuals with a pedophilic sexual interest without feelings of guilt, shame, or anxiety, and without functional limitations due to their paraphilic impulses may have a pedophilic sexual interest but not a pedophilic disorder. Factors indicating a diagnosis of pedophilic disorder include self-report interest in children, use of child pornography, a history of multiple child victims, boy victims, and unrelated child victims. Examples of individuals who deny attraction to children include those who are known to have sexually approached multiple children on separate occasions but deny urges and fantasies about sexual behavior involving children. Those who may further claim the known episodes of physical contact were all unintentional and non-sexual. Those who may acknowledge past episodes of sexual behavior involving children but deny any significant or sustained sexual interest in children. Because these individuals deny experiences, impulses, or fantasies involving children, they may also deny feelings subjectively distressed. They may still be diagnosed with pedophilic disorder despite the absence of self-reported distress, provided that there is an evidence of recurring behaviors persisting for 6 months, and criterion B, they have acted on the sexual urges or experienced interpersonal difficulties as a consequence of this disorder. The prevalence, so less than 3% among men in international studies. So for women, it's very uncertain, but it's likely to be a smaller fraction. Development and course. Adult men with pedophilic disorder may develop a strong sexual interest in children around puberty. During the same time frame, men without this disorder develop sexual interest in physically mature individuals. Criterion C requires for diagnosis a minimum age of 16 and at least 5 years older than the child or children in criterion A, due to the difficulty differentiating pedophilic disorder from age-appropriate sexual interest in peers or from sexual curiosity. So pedophilia is a lifelong condition, but the pedophilic disorder, like the characteristics might change over time with or without the treatment, such as subjective distress, psychosocial impairment, or the tendency to act out. Adults with pedophilic disorder may have a pre-existing awareness of sexual interest in children before engaging in sexual behavior involving children, or identify themselves as individuals with pedophilia. You see, with the advanced age, it's expected to decrease in the frequency of the sexual behavior, which is common for anyone, even those without the disorder. The risk and prognosis factors, temperamental. So the link between pedophilia and antisocial personality traits suggests that men with pedophilic interests and antisocial personality traits are more likely to engage in sexual behaviors with children. Environmental. Adult men with pedophilia may have experienced childhood sexual abuse, but the causal relationship is unclear. For the genetic and physiological factor, so we have to look at the probability that might affect, like the conditions that might increase the chances of pedophilia. Neurodevelopmental perturbation in utero may increase the probability of developing a pedophilic interest. For the differential diagnosis, pedophilia. Individuals with pedophilia experience intense sexually arousing fantasies or urges involving children. A diagnosis of pedophilic disorder is not warranted unless they act out on the fantasy or the urges cause distress or interpersonal difficulty. Other pedophilic disorders. So, for example, for someone that has the exhibitionistic disorder that expose themselves to both children and adults, they might be evaluated for pedophilic disorder, but it depends. They might be diagnosed with one or the other. It depends on the population that they exposed to. And we already know about the antisocial personality disorder. Some traits are overlap. Substance intoxication's disinhibiting effects may increase the likelihood of someone that normally attracts to mature persons to sexually approach a child. And for OCD, individuals sometimes complain about thoughts and concern about attraction to children, but clinical interviews reveal no positive feelings, no connection between these thoughts and sexual behavior, and sometimes intrusive sexual ideas like homosexuality. Comorbidity, substance use disorder, depressive disorders, bipolar disorders, anxiety disorders, antisocial personality disorder, and other pedophilic disorders. The interventions, there are many psychological approaches and some are manualized, and they use in correctional facilities or some outpatient and inpatient settings. The examples are CBT. So the approaches that they're going to use, the techniques are conditioning, behavioral skill training, social skill training, empathy training, and addressing the underlying sexual arousal patterns. Another famous theory that they use is psychodynamic. So they're going to use this technique to explore intrapsychic and unconscious conflicts and their relation to development, identify defenses, using free association to explore internal conflict and problems, interpret the transference, explore defense mechanism. Relapse prevention therapy is also very important. It focuses on the dynamic factors such as intimacy, attachment, emotional regulation, impulsivity, and therapeutic relationships. Good last model is rehabilitation program that aims to equip offenders with the skills necessary to attain human and normal desires in personally meaningful and socially acceptable ways. And there are also biological approaches as well. The use of anti-androgen medication, luteinizing hormone, releasing hormone, agonists, and some SSRIs such as citalopram. That's it. Thank you.